The opioid crisis in America isn't slowing down. Since 2000, over 1 million people in the U.S. have died of overdoses, the majority due to opioids. And we're here at the New York State Office of Addiction and Support speaking with Commissioner Chinazo Cunningham about the crisis, specifically how to recognize the symptoms of addiction and treatment and recovery options. Once again, thank you so much for having us here and educating us so we can share this information. We really appreciate it.
Thank you. Thank you for having this topic.
Yeah, for sure. Let's start with the basics, help folks understand what are opioids, and there's kind of two ways to get them, prescription and illicit. Can you expand on that for me?
Yes. So opioids are narcotics. There are things that you've heard about like morphine, codeine, heroin. Opioids also exist in the human body naturally, but can be taken externally too. So people are prescribed opioids, typically for severe pain, and people can also get opioids really through the drug market, like through heroin and now fentanyl as well.
Talk to me a little bit about what the symptoms of addiction are. How can you tell, for example, that a loved one might be struggling?
Right, so we define addiction really by two hallmarks. One is that somebody loses control over using that substance. So they're taking more and more to get the same effect. The second thing is that somebody continues to use that substance despite negative consequences. So if it's causing problems in the relationship, problems at school, problems at work, but people continue to use that substance. So that's really the hallmark. Of course, there's also, physical changes that we can see. Sometimes people develop withdrawal symptoms if they don't have the substance, or if they're intoxicated, they may look like sleepy and kind of nod off.
Who is susceptible to addiction?
Anyone is really susceptible to addiction. I think, it's $1 million question about who gets addiction. It's complicated. We don't really know the answer to that. There's certainly biological factors, there's environmental factors, also psychological factors. But what we also know, at least today, is that the outcomes of everybody is not equitable. And what I mean by that is if you look at who's dying of overdose deaths, it's a higher rate among Black people and Hispanic people.
Why is that?
Yeah, so there's a long history around drug policies in this country that were inequitably applied to communities. So for example, in the past, if you were found to have crack cocaine instead of powder cocaine, you got sentenced much more harshly in the criminal justice system. And Black communities had much more crack cocaine and white communities had more powder cocaine. And so the sort of baked in racism in our system has certainly contributed, and this is with our drug policies, this is with our healthcare system, this is with our treatment system. So it's really been across the board it's sort of not a surprise that unfortunately we see the poor outcomes in Black and Hispanic communities, and the reasons for that, are really that there's been institutional racism within our systems for decades.
Let's talk more about those opioid overdoses, some which lead to death. Why are the statistics of opioid overdoses so high?
Yeah, so fentanyl is really driving the overdose deaths. So fentanyl is an extremely potent opioid. It's about 50 or 100 times more potent than heroin. And fentanyl is really contaminating the drug supply. So it's not just in heroin, it's also seen now with cocaine, it's also seen with methamphetamines, it's also seen with counterfeit pills. So it's everywhere.
There is a stigma around taking medications when it comes to harm reduction. Can you clarify why some people need to take medications and what those medications are?
Yes. There are 3 medications that are approved for the treatment of opioid addiction in the United States. So naltrexone is an injectable medication, methadone, and buprenorphine, also known as Suboxone. These medications are very effective. They've been very well studied for decades, and they reduce the risk of death by about 50%. The challenge is that of all the people that need these medications, only about 10 to 20% of people get them. And I think there's a lot of reasons for this. So there's a lot of stigma around medications. I think people often think that can't somebody just stop? Can't they be strong enough and just stop? And what we know is that addiction is a medical condition. And it's not just about willpower. It's that the brain has been, the circuits in the brain have been rewired. And so these medications stabilize those circuits, and they're effective. And so often people, get really good results with the medications, and they may need to take them for life because people have to manage their addiction lifelong. There is no cure. And like other medical conditions, like diabetes, like, heart disease, people have to manage that, right? And they have to manage that through their behaviors, and often they have to manage that through medications as well.
So we've covered a lot of ground, and I want to dive now into treatment. We've talked about harm reduction, and earlier you said harm reduction can get some folks into a place where they're ready to step into treatment. Who can access your treatment programs?
Anybody can access treatment programs in New York State. So regardless of the ability to pay, we provide support so that nobody should be turned away.
What can someone expect in treatment?
Yeah, so I think part of the first step is to sort of figure out where people are. There's no one answer for everybody, right? So people are at different stages in their addiction, and we really want to make sure that we're using a person-centered approach so that we can fit the best treatment for that person at that time of their life. So different people need different, supports at different times in their lives. And so we have everything from very intensive inpatient settings to, outpatient where people can come daily, to programs where people come once a month, to programs where people are supported because they're in recovery.
What kind of approach does your office take toward treating opioid addiction and recovery?
So really, our goal is to provide a full continuum of services so that whether you're early in your process, whether you're 20 years in your process, whether you're in New York City or the North Country and rural areas, that there are services available. So there's a whole continuum that really should be able to address the needs of anybody regardless of where they are in their addiction.
So those that use, many know they need recovery. They're not ready to step forward. Family members may see that they need recovery. How do they have this conversation with their loved one to say, it's time to go into treatment?
Yeah, well, so, what I would say is sometimes it's challenging. It's certainly not one conversation, right? I think certainly seeing what's happening, paying attention to some of the signs and symptoms of whether people are developing a problem with addiction, letting people know that you're there to support them, but that treatment exists. That treatment is effective, right? But with anything, we can't force people to change, but we can be there to support them, as they're willing to change and working on changing. And I think that's really, the roles of the family members is to be there to support people, to make sure that they know what services are available, and encourage and provide that support. But we can't force people to change.
And you said with so many different pathways and people recover differently, how do you handle or manage when someone has a relapse? How do you make family members understand that can often be part of the process?
Relapse is part of the process, 100%. So that is the nature of addiction. And when relapse happens, we need to make sure we can keep people alive, right? So having the naloxone or Narcan on board, and then getting people into services quickly. So there's sort of, the mini relapses where people, have a blip in their recovery and then can get plugged back into services pretty quickly and get back on track. And then there's others where it may take a lot longer for that to happen. But relapse is part of addiction. It does not mean that somebody's weak. And it really is about plugging back into services, getting the support and getting the treatment that is effective.
How does OASAS assist those in recovery to stay in recovery?
So we have a whole range of services for people in recovery. So we support recovery centers, For youth, we have clubhouses, and we support peers as well. They're certainly a critical part in the work around recovery. And a lot of the work is really to think about, coping skills and healthy activities, right? And making sure that those supports are available among peers and communities, and so that there's activities that people can be doing and working on themselves in other ways. So working on their housing, working on their education, on employment, as their recovery remains stable. This is a lifelong process. And it's so important for people to make sure that they know about the supports and the services that are in their community, because it's hard to know from one day to the next what you're going to need, but to know that they're out there so that if there's a need, those services can be accessed.
Recovery is possible.
Recovery is absolutely possible.
Well, we really appreciate your time.
Thank you so much.
Yeah.